matters, Cameroon has become the first nation to roll out a malaria vaccine. The nation is focusing on the population of children. Let's have this conversation with our guest. He is, just to get that name correctly, he is with the United Nations, the World Health Organization. He is a team lead. He is a team lead vaccine preventable disease. He is Dr. Charles Wilson. Good to have you join us. All right, Dr. Charles, how significant is this for Africa, and what role did the World Health Organization play in this?
This is very significant, and it is like, just to give you a perspective of what I think it is like, it's like landing on the moon. Malaria kills more than 500,000 children in Africa every year. And this, within the context of other malaria prevention interventions like indoor spraying and the use of insecticide-treated nets. So having this malaria vaccine is going to add to this, and it will have a big impact because it's a safe and effective vaccine. What was WHO's role in it? You just asked. The World Health Organization, WHO, was involved since 2019 to now, to December 2023, in coordinating a pilot program for this malaria vaccination, which took place in Ghana, in Kenya, and in Malawi. And during this time, 6 million doses of these vaccines were administered to more than 2 million children, and we have had significant impact. More than 13% reduction in mortality from all causes in these communities. So that's the role WHO played in helping us reach this milestone.
Mm. And how are you addressing the issue of resistance? Because there are concerns in Cameroon that, look, some parents say they are worried about the safety of the vaccine for their children. How are you addressing this?
Okay, let me just start by saying that vaccines in general, vaccination of children each year serves 4 million to 5 million children from dying each year. The addition of this malaria vaccine would again save tens of thousands of children from dying. With us at WHO, safety is very important. And for WHO to have pre-qualified and recommended this vaccine is because we went through all the data on this vaccine and found that it is safe and it is effective. Overall, in Africa, we know that a large majority of people would take vaccines, but we are aware of a small minority, often very vocal, who have concerns and spread a lot of misinformation about vaccines. So what are we going to do? We're going to ensure that we spread the right information, that parents and caregivers and all communities, that they get the right information, that this vaccine is safe and it is effective. And that if large numbers of children take the 3 doses that are required, and with the 4th dose, we're going to save tens of thousands of children. The next thing we're going to do is we're going to work with communities, do community engagement. So what WHO has done is to work with Cameroon and with other countries that are going to introduce this vaccine to develop plans for risk communication, to spread the right information out there and ensure that we use trusted voices to pass out the right information, just so that this misinformation about the vaccine does not prevail.
And what other countries are showing interest in this vaccine? Where might we see the next rollout?
So there is a lot of unprecedented demand for this vaccine. More than 30 countries in Africa have expressed an intention to introduce this vaccine. But this is what happens. The decision to introduce the vaccine is made by the countries. They look at their malaria burden, they see what impact it has, how many children die from malaria. They look at the evidence on the safety and efficacy of this vaccine, and then they take the decision at country level that they would introduce the vaccine. And that has happened already. 20 countries have already taken the decision to introduce this vaccine, and they have applied to the Global Alliance for Vaccines and Immunization for support. and they have been supported, and they are going to be introducing this vaccine. The next country, so many countries have received consignments of these vaccines already. Liberia has received, Benin has received, Burkina Faso has received. So tomorrow, on Friday actually, vaccination will start in Burkina Faso.
Quite interesting. We'll see how, Burkina Faso rolls this out as well. Burkina Faso rolls this out as well. Thank you so much for talking to us. Dr. Charles Wilson, Team Lead, Vaccine Preventable Diseases, WHO Regional Office for Africa.
Thank you.